Here, this side is the which is the posterior nasal aperture. And now I'm gonna discuss the arteries that supply the nose from inside of the nose. We have many of the arteries, 5 arteries. Sphenopalatine artery. This is the sphenopalatine artery, which comes from the maxillary artery. هذا السفينوبالاتine, which comes from the maxillary artery, which is one of the terminal branches of the external carotid artery. We have 2 ethmoidal arteries, anterior and posterior, and ethmoidal arteries, anterior and posterior. We have also greater palatine artery. We have also superior labial artery. Superior labial, greater palatine. ما مقشرينه بأي مختبر الجريتر palatine. بينما عندي superior labial احنا اصلا قشرناه, which is part of the facial nerve, كان مبين على الوجه. هذا superior labial. This is the superior labial artery, which extends deeply to supply the nose from the upper side. As for the how we can memorize them, by a word leg. The L refers to the superior labial artery, the E refers to the 2 ethmoidal arteries, and the G refers to the greater palatine artery, and the S refers to the sphenopalatine artery. This is the most important one, which is the sphenopalatine artery. Now we are gonna discuss the lateral side of the nasal cavity. The lateral side of the nasal cavity. First of all, I want to enumerate the paranasal sinuses. This is the frontal sinus. The ethmoidal sinus does not appear here, but is موجودة بالجثة الحقيقي. ethmoidal sinuses. We have the sphenoid sinus and a group of ethmoidal ethmoidal paranasal sinus مثل ما قلتوا هذولي اللي هون يظهرون بس ما موجودين بهذا المجسم. عندي الماكسيلاري ساينس أيضا هم موجودين. That's all for the sinuses. Here we have superior, middle, and inferior concha bones. The superior and middle usually fuses or merge one to another. They appear as one concha in some of the structures, and that's appear موجود بالجثة الحقيقي إنه السوبريور والميدل they are connected together. And about the inferior concha, it's separated independent bone, independent by itself. First of all, we will start by the superior concha. At the lower border of the superior concha, we have the superior meatus. The superior meatus, in which the sphenoethmoidal recess opens. This is the sphenoethmoidal recess, which opens in the superior meatus. And the posterior opening of the ethmoidal sinus. Ethmoidal sinus has 3: posterior, anterior, and middle. The posterior one of the ethmoidal sinus opens in the superior meatus, in addition to the sphenoethmoidal recess. Why we call this sphenoethmoidal recess? كلش important ومهم. هذه sphenoethmoidal recess. Why it's called sphenoethmoidal recess؟ حتى اللي ينسى اسمه واضحة. هذا السفينويد بون وهذا الethmoidal bone. So it's called as sphenoethmoidal recess. So it's called as a sphenoethmoidal recess. What is the structures opens in? It opens in the superior meatus. Now we end from the superior meatus, the middle meatus, which is under the middle concha. The middle meatus, in which we have the infundibulum. أول structure بالداخل، يعني هي داخلها كتلة structures. infundibulum, hiatus semilunaris, and the bella ethmoidalis. بالعملي ما إنه تذكرهم كلهم بالتفصيل هاي structures بس بالنظري. بس إيش هي اللي يفتح بيها؟ We have 4 sinuses open in the middle meatus. we have the anterior ethmoidal sinus, maxillary sinus, middle ethmoidal sinus, and the frontal sinus. Frontal sinus, two ethmoidal sinuses, the anterior and the middle, in addition to the maxillary sinus. As for the inferior meatus, which is very important clinically, opens in it the nasolacrimal duct. Nasolacrimal duct, which connects the lacrimal sac from the eye. Why it's very important clinically. راح أشرح الكلينيكال features من هاي المختبرات الفيديو بواحد حتى لا تتلخبط مع البقية. Here we have the nasopharynx. It starts from the beginning of the soft palate. The boundaries of it anteriorly, which is the posterior nasal aperture, posteriorly, which is the C1 or basilar part of the occipital bone, basilar part of the occipital bone, and also part of the C1. Superiorly is the sphenoid bone. This is the sphenoid bone superiorly. Inferiorly is the soft palate. Why? Because the soft palate close when the food is coming here. So the soft palate close and close all the nasal cavity, so the food don't return to the nose, to the nasal cavity. So the inferior border we will regard it as a soft palate. Laterally is the auditory tube. This is the auditory tube, auditory opening for the auditory tube. It contains pharyngeal tonsil. Pharyngeal tonsil. This is the pharyngeal tonsil. This is the pharyngeal tonsil, or called as an adenoid. It has a tuber ridge. This is a ridge around the auditory tube. Auditory tube, or Eustachian tube, or pharyngeotympanic tube. It has 3 names, and this called as a tuber ridge. Here we have a fold, kind of fold, called as salpingopharyngeal fold. Salpingopharyngeal fold, covering the salpingopharyngeal muscle. هون بالأخير هذا مثل الرسس بالأخير اللي هو pharyngeal recess. This is the pharyngeal recess. This is the salpingopharyngeal fold covering the salpingopharyngeal muscle. And this is the opening of the Eustachian tube.